Greetings from Suraj Eye Institute. Suraj Eye Sciences Academy presents the Spark Case-Wise. We present to you a case of Iridocorneal Endothelial Syndrome. Iridocorneal Endothelial Syndrome is a rare disorder with abnormal corneal endothelium that leads to varying amount of corneal edema, iris atrophy, and secondary angle closure glaucoma. It typically affects young females and is usually unilateral. A male, 15 years of age, presented with the chief complaints of blurring of vision and colored halos in left eye since 1 year. There was no significant past ophthalmic and systemic history. There was no history of similar complaints in the family members. There was no history of redness, pain, watering, trauma to left eye, or diurnal fluctuation of vision. Ocular examination of right eye showed a best corrected visual acuity of 6.6 N6, anterior segment within normal limits, and intraocular pressure of 18 mm mercury. Left eye had a BCVA of counting finger 2 meters N36, anterior segment showed microcystic corneal edema, atrophic iris patches, polychoria, and intraocular pressure of 48 mm of mercury. Fundus examination of right eye showed healthy disc and left eye showed a vertical cup disc ratio of 0.75:1, pale neuroretinal rim with thinning superiorly and inferiorly, and areas of retinal nerve fiber layer loss along the superior and the inferior arcade. Patient was started on topical alpha agonist and beta blockers, following which there was significant reduction in the corneal edema, and he was advised Ahmed glaucoma valve implantation surgery, which was done on 14th June 2019 in left eye in inferonasal quadrant using standard operating technique. Post-operative visual acuity was 660 in left eye after 4 months. Post-operative intraocular pressure was well controlled in early post-operative period. At 3 weeks post-op, intraocular pressure recorded was 28 mm mercury, which was suspected to be due to hypertensive phase post-AGV implantation. Patient was advised to restart topical alpha agonist and beta blockers, and intraocular pressure recorded at 5 weeks was 12 mm mercury, which was stable at 16 mm mercury till 6 months follow-up. As the etiology of eye syndrome remains unclear, the treatment is mainly focused on managing the glaucoma. Trabeculectomy may be done in these patients, but it has a higher rate of failure due to subconjunctival scarring. Glaucoma drainage device may provide an effective and relatively safe alternative treatment in cases of patients with eye syndrome. In view of the above, we decided to perform a primary AGV for this patient, and we achieved satisfactory IOP control over a period of 6 months. Thank you.